Breast cancer can start quietly, but knowing the signs and taking simple steps can save lives. Hey friend, have you ever wondered what breast cancer really is, or worried about changes in your breast or chest? Many people feel scared or unsure, but knowledge brings power and hope. Today we're explaining everything in simple, clear words: what breast cancer is, how common it is, the early warning signs everyone should know, risk factors, how to check yourself, screening, treatment, and the good news about survival. This video is for women, men, and anyone who cares about their loved ones. If you're new here, welcome. Hit subscribe and turn on notifications so you never miss practical health tips. Let's learn together and stay healthy. First, what is breast cancer? Breast cancer is a disease where cells in the breast grow out of control and form a lump or tumor. These abnormal cells can sometimes spread to other parts of the body if not found early. Most breast cancer starts in the milk ducts or lobules, the parts that make milk. There are different types, including non-invasive, staying in one place like ductal carcinoma in situ or DCIS, and invasive, spreading into nearby tissue. The good news is that when caught early, breast cancer is often very treatable. In 2026, about 321,910 women and 2,670 men in the United States will be diagnosed with invasive breast cancer. That means roughly 1 in 8 women will face it in her lifetime. Worldwide, it is the most common cancer in women. But thanks to better screening and treatments, many people live long, healthy lives after diagnosis. There are already millions of breast cancer survivors. Now let's talk about the early warning signs. Breast cancer doesn't always hurt, so regular checks are important. Here are the signs everyone should know. Minus a new lump or thickening in the breast or under the arm. It may feel hard or different from the rest of the tissue. Changes in the size, shape, or look of one breast. For example, one side suddenly looking larger, smaller, or uneven. Skin changes on the breast like dimpling, like orange peel, puckering, redness, rash, or scaliness. Nipple changes, the nipple turning inward, inverted, becoming painful, red, or scaly, or having discharge that is not breast milk, especially if clear or bloody. Swelling or pain in the breast or armpits that doesn't go away. These changes can sometimes be caused by other things, but please don't ignore them. See a doctor right away for peace of mind. Early detection makes treatment easier and more successful. Men can get breast cancer too, though it is rare, less than 1% of cases. Signs in men are often a painless lump under the nipple or changes in the nipple or chest area. Men are sometimes diagnosed later because they don't expect it, so awareness matters for everyone. What causes breast cancer? The exact cause isn't always known, but certain risk factors can increase the chance. Being a woman and getting older are the main ones. Other factors include family history of breast or ovarian cancer, or inherited gene changes like BRCA1 or BRCA2, starting periods early or menopause late, having children later in life or not having children, being overweight, especially after menopause, drinking alcohol regularly, smoking or not being physically active, using certain hormone therapies after menopause, previous radiation to the chest for other conditions. Having risk factors doesn't mean you will definitely get breast cancer. Many people with risks never do, and some without obvious risks still develop it. The key is knowing your own situation and talking to a doctor. Prevention and early detection are your best tools. Here are simple things you can do. Stay healthy every day. Eat plenty of fruits and vegetables. Keep a healthy weight. Move your body regularly. Limit alcohol and avoid smoking. Breastfeeding when possible can also help lower risk for some women. Perform a monthly breast self-exam to know what is normal for your body. It's easy and takes just a few minutes. Here's how to do it step by step. 1. Stand in front of a mirror with your hands on your hips. Look at your breasts for changes in size, shape, or skin. Check both sides. Raise your arms overhead and look again. Press your hands on your hips and lean forward slightly to check for dimpling or changes. 2. In the shower or lying down, use the flat parts of your 3 middle fingers. Press with light, medium, and firm pressure in small circles. Cover the entire breast, from the nipple to the outer edges and up into the armpit. Do this for both breasts. 3. Gently squeeze each nipple to check for discharge. Do this once a month, a few days after your period ends if you still have periods, or on the same day each month if you don't. Get to know your breasts so you notice any changes quickly. Get regular screenings. Talk to your doctor about mammograms, a special low-dose X-ray of the breast. Many guidelines recommend starting at age 40 or earlier if you have higher risk. Clinical breast exams by a healthcare professional are also helpful. If you have dense breasts or higher risk, your doctor may suggest extra tests like ultrasound or MRI. If something feels wrong, don't wait. See your doctor for tests like a mammogram, ultrasound, or biopsy to find out exactly what is happening. If breast cancer is diagnosed, treatment depends on the type, stage, and your personal situation. Common options include minor surgery, removing the tumor or the whole breast, sometimes with reconstruction, radiation therapy, chemotherapy, hormone therapy if the cancer grows with hormones, targeted therapy or immunotherapy for certain types. Many people receive a combination of treatments. Doctors now use personalized plans based on the cancer's characteristics, so treatment is more effective, with fewer side effects than in the past. The good news about survival: when caught at the localized early stage, the 5-year survival rate is over 99%. Overall, the 5-year survival rate for invasive breast cancer is around 91%. Death rates have dropped dramatically by about 44% since the late 1980s, thanks to better screening and treatments. Millions of people are thriving as survivors today. Breast cancer can feel overwhelming, but you are not alone. Early action, regular checks, and healthy choices make a big difference. Talk openly with your doctor about your risk and the best plan for you. Share this knowledge with your family and friends. It could save a life. If this video helped you feel more informed and empowered, please give it a thumbs up. Leave a comment saying breast aware below and subscribe for more caring health education videos. Protect yourself and the people you love. Stay aware, stay proactive, and stay hopeful. Thank you so much for watching. Take good care of yourself, and I'll see you in the next video. Always consult your doctor for personal medical advice.